here we had a very interesting trial in which I was having the opportunity to help from the clinical side, and actually these were a group of trials together, and two of the trials were aiming at Alzheimer's disease. One of the patient population was what is called prodromal Alzheimer's disease, meaning patients who have not yet developed dementia but have symptoms in terms of memory disturbances and other associated cognitive disturbances, not strong enough to interfere with their daily life but still noticeably. And the other population, the other clinical trial, was a patient with mild dementia of Alzheimer's disease. So these two types of patients are really in the forefront of really the target population for new developments and innovative treatment in Alzheimer's disease, because they both have indication of Alzheimer's disease pathology but in various degrees of cognitive impairment, and yet they are not so severely affected and their brain is not so much damaged by the disease that innovative and modern treatments might still have a chance to improve or interfere with the biology so that this is the worthwhile target at present. Of course, there are other attempts to study even patients or subjects, one would rather say, with even earlier stage of Alzheimer pathology, like patients who have no symptoms at all or just feel that they're not functioning as well as they think, but when you test them then you see they are functioning normally. Though these patients with subjective cognitive decline or preclinical Alzheimer's disease are also an interesting target. However, this is much more on a scientific level than the other symptomatic patients. Then I still think in the final end we will have to deal with patients who feel and show that they have symptoms and not just with subjects who have a change in their biology. So those subjects will have a hard time to getting really access into the usual medical care system all over the world unless they do have symptoms.